Awareness on Postpartum Depression by Alexis Sostre. Postpartum depression is the most common psychiatric disorder seen after childbirth. Postpartum depression is a worldwide issue within postnatal care for women, affecting 10 to 15% of new mothers. Postpartum depression not only affects the mother in a negative way, but also the baby, causing social, emotional, behavioral, and cognitive problems for both. Talking about postpartum depression hits home for me because it's something that I have gone through and it's changed who I am. If it is not for my bravery to speak up on my thoughts and my feelings and the mental help and support I received, I don't know where I would be in life today. Now that I'm a parent and I have friends on social media, I see postpartum depression as something that's talked about more, but is not fully understood in society. Providers had a better understanding of postpartum depression and all that it entails with treatment and support, utilizing early interventions can be implemented to reduce the severity of symptoms and take away the negative stigma behind postpartum depression. Early detection of postpartum depression can make a difference in prevention and treatment for mothers and their children. As many as 80% of new mothers develop the baby blues within the first couple of days of childbirth. These mild symptoms like tearfulness, sadness, mood swings, irritability, and fatigue generally subside 2 weeks postpartum. This is after childbirth. Not in every case these symptoms go away, with social isolation, lack of support, and marital discord can be the leading risk factors of postpartum depression. Postpartum depression is not something typically discovered at well-care checkups by providers unless the mother speaks up about her recent behaviors, emotions, or if it's reported by a family member to the healthcare provider. Edinburgh Postpartum Depression Scale, the EDBPS, is a screening instrument that is used to measure depressive symptoms but cannot confer the diagnosis of depression. Alexandru studied the perception of healthcare visitors and their roles of assessing managing postpartum depression cases in the community, bringing more awareness to the faces of postpartum depression. The nurses in this research stated there is a lack of proper protocol and guidelines to identify and assist mothers who are showing symptoms of postpartum depression. Some nurses did not see that identified postpartum depression was part of their job descriptions, since their primary job is for well-care checkups for the child. The nurse may be the only social interaction that mother has outside of her home. With the higher level of expertise and protocols, the nurses can be more accessible into the intervention and refer the mother to the appropriate mental health care. It should not only be primary care providers' responsibility to identify postpartum depression symptoms, but for all professionals involved with women health care to be able to aware of the postpartum depression and to address the needs to mothers. Ross's article focused on the study of lifestyles for 4 women diagnosed with postpartum depression. The participants were grouped into 2 different groups, essentially meaning structure groups. The first group experienced the fear of the looming threatening world, and the second group experienced the loss of premortal mindness. The 3 of the mothers fell under the looming threatening world criteria. They feared that their child's safety is in this dangerous world. In Group 1, 6 essential contingents were identified: the vulnerable baby in the threatening world, perforated, anxious in self and motherhood, in the live body as heavy physical obstacle of mother's attunement, the baby as a catalyst for guilt, shame, and remorse, ambulance concerning practical support and positive feedback, and withdrawal from others and loneliness. As a new mother, the world can seem as a scary place, and you want to do whatever possible to protect your child. And the fear that you may feel can cause a lot of weight on one's shoulders, leading yourself into self-doubt and to insecurities. The other mother was categorized as meeting the criteria to experience the loss of premortal mindness. She dealt with the dissociative symptoms resulting in an emotion and mental disconnect from herself, the baby, and the world. There were 3 essential contingents identified: unreal world and others, unreal self, and unbearable anxiety. The inability to having your own perception, emotions, or thoughts on the lead to disassociate for self-awareness. 2 essential meaning structure of postpartum depression revealed that depression is not something that you have while as a person remain unchanged. Rather, depression is something that you live. After having a baby, a mother may feel as she's lost herself. The body you once had is no longer the same. If you're a mother who breastfeeds, you are now the main source of food supply for your child, and it can be draining at times that you have to keep up with their supply and also pump to provide for your child for when you are not around. Not only do you lose yourself physically, but you also lose yourself in the world. The life you lived before would be nothing like the life that you live now as a new mother. Living with postpartum depression was hard because I felt that I would be judged and misunderstood, so I kept it to myself a lot. I was even scared to share these feelings with my husband as I thought he would look at me differently. Normal social interactions I used to take part in didn't feel the same anymore. I would feel exhausted by leaving the house even if I wasn't tired. Being around people would seem to give me anxiety to the point to where if I didn't have to leave my home, I wouldn't. Once I started treatment for my postpartum depression, it did help with suppressing those feelings, but I didn't like the fact that I had to depend on a medicine to make me happy or to feel normal. Prescription medicine is not the only way to help with postpartum depression, for it is for those who need synchronization at a biological level. With therapy can help you with resynchronization by using activities that promote attunement to the baby and synchronity to the social world. In Boredom study, he studied the stigma behind postpartum depression treatment acceptability among Black and white women in the beginning of postpartum to understand the stigma and the acceptance of therapies between the two races. 4 different postpartum depression therapies were studied for the stigma associated. 2 standard treatments for postpartum depression was for mental health and for medication. The other 2 were herbal remedies and spiritual counseling. White mothers were found to be more accepting of the prescription medicine and mental health therapy than Black mothers being more accepting into opening to herbal remedies and social and spiritual counseling. Medical insurance also plays a role in accepting and receiving mental health therapy and prescription medicine. Black women who had private insurance and who had trusted into the health care were more accepting than those that were on Medicaid. Other barriers that can prevent mothers to receive treatment postpartum depression is the lack of knowledge, the lack of access, transportation, child care, and costs, especially in minority women. A mother's medical status should never affect her rights in obtaining mental health care when not only the mother is negatively affected, but also the child. Overall, the stigma in accepting treatment with mental health counseling is high and should be more further investigated to reduce the stigma on postpartum depression and treatment. Postpartum depression often gets masked by postnatal behaviors because of the time the mother is adjusting to the new way of life, but the symptoms should not be overlooked as early detection could provide treatment and manage the negative effects on both the mother and the newborn. The key to the symptoms being discovered is recognized sooner is diligent patient care post-birth. The responsibility lies with the medical professional involved with the nurse and the delivery room to the obstetrician until the patient does follow-ups with weeks later. Early detection will expose the patient to effective treatment methods sooner. This will reduce all negative stressors to the postpartum depression patient experience while trying to sort it out in their head themselves. There are multiple assessment tools and scales that are disposable that they need to execute the actual application. Also, physicians should pay special attention to those mothers that have prior psychological disorders. The only way to erase the stigma around using awareness campaigns and to cater to each audience. There are women that experience postpartum depression and never been properly diagnosed because they are unaware of its existence. There are husbands and fathers that are misunderstood their spouse's struggle and took their sadness as a phase that they will overcome, when truly treatment should have been administered. Also, awareness campaigns for the general public so they can have a better understanding and take a more sympathetic stance in support of postpartum depression survivors. Women clinics can offer more mental health education and for new mothers and offer low-income treatment options to give the opportunity to women that cannot financially afford medical attention but are in need. My resources all reflected the broad range of factors that determine if a mother met the requirements for postpartum depression and changes the experience during the time period. It is important for society to understand postpartum depression is an ongoing disorder and it is managed for the rest of that patient's lifetime.